guys, it's Khaki. I wanted to make a video talking about the supplements and vitamins that I take after I had gastric bypass surgery the day before Thanksgiving last year, and also kind of talk about my perspective as a healthcare provider on the vitamin and mineral needs of those who have had weight loss surgery. Now, of course, you need to speak to your team, your surgical team, your dietitian, your surgeon, your PA, nurse practitioner, whoever, about what you need personally. But these are just some overall guidelines and some ways that we as bariatric patients can get into problems with vitamin and mineral deficiencies. A few of the things that we eat and the supplements that we take require acid that's produced from our stomach to be fully absorbed. Well, there's a couple of issues with that. Once you've had a restrictive procedure, such as gastric bypass or gastric sleeve, you are not, the food that you eat and the supplements that you take don't come in contact with the lining of your stomach for very long because there's not much stomach there anymore. So, those acids that are produced in the lining of the stomach simply aren't there in enough quantity to break those nutrients down and help with absorption. That's especially true in B12. You require an acid to help break it down, then you require something called an intrinsic factor to help absorb it. People who have what we call pernicious anemia have a deficiency in that intrinsic factor so that they don't absorb B12 and require outside supplementation. So, that is why a lot of us who have had gastric bypass and gastric sleeve need supplementation of B12, but it can't be swallowed because it won't absorb well. I personally take a B12 injection once a month, and I'm going to put a picture up of that. It's called cyclobalamine is the chemical name for B12. You can also take this sublingually. You can take this intranasally. The injectable is just what I chose so that I wouldn't have anything extra to do, and my insurance covered it very well. So definitely speak to your healthcare provider, your PCP, your bariatric team about that. Another thing that I take 3 times a day is calcium supplements. One thing that we get into trouble with as bariatric patients is we cannot absorb calcium carbonate, which is the most common form of calcium supplementation that you buy over the counter, what is that? Caltrate is one of the biggest brands in that. Here again, it requires acid from our stomachs to be absorbed, and you just don't have that acid anymore. So the form that is most easily absorbed by gastric bypass and sleeve patients is calcium citrate. And the way that I choose to get that is through a chewable. I like, there's several brands that I like. I'll put pictures in of them. But each one of these has 500 milligrams of calcium. It's recommended for me and for most gastric bypass patients to take 12 to 1500 milligrams of calcium a day. They have to be spaced out over the day, and they can't be taken close to or with your iron supplement because that messes up absorption. So it's kind of tricky to space that out, but if you get into a good routine, that will help get things going. The days that I drink a protein shake, I only take 2 of the calcium because that protein shake, check your labels of the protein shake you like. But my protein shake gives between 400 and 500 milligrams of calcium. So I don't have to, it's just an extra pill that I don't, or extra chew that I don't need on the days that I have a shake. They are pricey, but one thing that I want to talk about, well, I'll wait to the end and we'll talk about that. Okay, vitamin multi. I like the ProCare Health Bariatric Multi with 45 milligrams of iron. They also make this without iron. They make it with 30 milligrams, so you can tailor to what you need. This is one a day. It is a small capsule. You see there. I remember years ago when I first had bariatric surgery patients, they had this huge regimen of supplements that they had to take to be able to get everything that they needed in. Now you can pretty much do it in that one a day. It is amazing how that has become refined, and I'm sure because of demand. There are more of us out there than there ever have been. Another thing that my dietitian recommended is a B complex. This is the one I actually have taken two. I'm almost done with this one and I have another one to start. I'll show you both. This is from Pure Encapsulations. This is, again, a very small capsule. I take it at night when I take my stool softener. Definitely a must for those of us who have had bariatric surgery. I just use the Equate brand, whatever is on sale. And I take these two together at night. The other brand that I have taken in the past, and I have a bottle of that I'm about to start, is the Bariatric Pal B Complex 50. These are pretty much interchangeable, have the same thing in them. So I just go for whichever one is on sale. So finishing up this bottle, about to start this bottle. Now, one thing I want to talk about is how we as bariatric patients can kind of develop a false sense of security due to our lab work. Many of vitamin and mineral deficiencies can take years to develop. When we go into surgery, we have not only a surplus of adipose tissue, aka fat, we have plenty of, in most cases, vitamins and minerals stored. If we don't supplement them, often it takes years for those numbers to go down, but they eventually will. One thing that I hear a lot of bariatric patients in my practice say is, well, my numbers are good, especially in calcium. Calcium citrate is expensive. It's time consuming. It's a hassle to get in 3 chews a day. Look, here's my calcium number. It's great. Yeah, it is. That calcium in your labs may never be down because your body is going to draw calcium into your bloodstream because calcium is very important. It helps with not only, everybody knows about bone health, teeth health, all that, but it also helps with vital organs such as your heart. So your body is made to compensate. Your calcium level may show normal, but you know what? Your body is leaching it from your bones. Your body is leaching it from your teeth. If you don't supplement it, there is a very real danger of your teeth weakening and falling out, and of your bones thinning and you becoming osteoporotic. Nobody wants that. And that's not anything that you can see in a lab test. Like I said, your calcium level may be great on paper. But then one day when you go to your dentist, they're going to say, gosh, when they do x-rays, or you're going to have a loose tooth, and they're going to say, are you taking your calcium? So remember that. Lab tests sometimes are a false assurance. Also, B12 deficiency can take 2 to 3 years after after bariatric surgery to actually show up on paper. So be proactive. Go ahead and supplement that. There is those of us in the bariatric surgery community, we all know you've got to get your protein in. Protein, protein, protein. But a true protein deficiency is very rare. What is more common is an iron deficiency. But here again, that hemoglobin and hematocrit that we look at on lab test doesn't tell the full story. Those can be normal, and you can have a you know what storm on the horizon and still have normal hemoglobin. The numbers that I look at to determine if somebody has problems brewing are that full iron panel, specifically the ferritin level. That's your iron stores. If that ferritin level starts trending down, that means you're leaching off your iron stores. Your body is keeping that hemoglobin where it needs to be, fighting, but it's drawing off of that ferritin. So one day, it's probably not going to be normal, and that can lead to, number one, feeling horrible and a lot of problems in other areas. So, if you are somebody who your bariatric team and your PCP, which is most gastric bypass patients and most sleeve patients, especially female, if they are telling you to take iron, do it. I find that iron, of course, we all know ferrous sulfate, that tends to cause GI upset and constipation. We're already constipated because of the surgery, most of us. So the iron that I like following bariatric surgery, there's a few other types other than the sulfate. Ferrous fumarate is one that's really well absorbed. So, if the cheap iron in the kind that you can get over the counter just at Walmart doesn't sit well with you, that's where you go back to these bariatric vitamins. Now, one thing that you don't see here that I take is biotin. Number one, most bariatric vitamins have adequate biotin already in them. So extra supplementation is not going to do anything. Hair loss, which believe me, I've had after gastric bypass, is a huge concern. But there's honestly not much we could do about it. I'm going to insert in the notes to this a link to a video by a bariatric surgeon who explains why we lose hair after bariatric surgery and can kind of shed some light onto a lot of extra supplementation. It's not going to do anything. Get your basics that your team recommends. The other reason that I don't like extra biotin, is it can throw your thyroid levels off. As a provider, when I do testing and I have someone who has a thyroid level that is off, of course, it can be hypo or hyperthyroidism without a doubt. But one of the first things that I will ask a patient is, are you taking biotin? And if they are, unless it's an alarming number, usually I will get them to stop the biotin and retest in a few weeks. And more times than not, that thyroid level is back to normal. Something to think about. I am going to put also in the notes for this video a link to the American Metabolic Bariatric Surgery Association vitamin guidelines. Most of your reputable pre or post bariatric surgery vitamins base what is in them on these guidelines. But it's good to look at when you find a new bariatric vitamin brand. It's a good thing to look at it and kind of compare it to what the guidelines for the actual organization that governs bariatric surgeons, and make sure that you're getting what you're supposed to. Anyway, folks, that is it. If you have any questions, I will be glad to help in any way. As I said, I'm not a weight loss expert. I am a healthcare provider, but I'm probably not your healthcare provider. And if I am, come in my office and ask me questions. But if there's anything else that I can help with just in a generic way about vitamins, my experience, please let me know. Comment below. I would love to hear what you're taking and how you feel like it's helping you. I hope everybody has a great week, and I will have my regular video out on Wednesday. Have a great day, everybody. Bye.